it's 18 minutes after 7. We're talking the SNIT hospital now. I've got my guests seated. They're celebrating something. They're on a certain course to get a healthy lifestyle. We all want a piece of it, don't we? So I've got Dr. Thomas Edunsia, who is welfare chairman, the Trust Hospitals Welfare Association, joining me, and the general manager, Dr. Darius Kofi Osei. So thank you very much, doctors, and good morning to you.
Good morning.
Good morning.
Is your hospital working? Obviously, yes.
Yeah, we work. Yes.
Okay, but you know the GMA is on strike.
Yeah, we are aware of that.
You're members of the GMA?
Yeah, we have members.
It's a challenge, isn't it? Because, you know, you work in a hospital that does not go on strike.
Well, I think our employers are different.
Okay.
Yeah, we are a limited liability company owned by SNIT. And I think our conditions of service is different from what other members are asking for.
Okay. All right. Are you getting a lot more patients than you would usually in your hospital?
We are, but I think naturally most patients come for reviews and follow-ups. So my observation is that when doctors are on strike, normally they checkups and things they don't come, and it's mostly emergencies. So we are not getting astronomical numbers as expected.
Okay.
But the numbers are above our normal attendant.
So okay. Yeah. So for now, you don't have any challenge, any difficulty.
More emergencies rather than the normal walk-in checkups that usually are on appointment.
But is that a challenge?
It is. Definitely it is, because we must hold ourselves in readiness for all eventualities that may happen.
But for now, you're able to deal with the situation.
Yeah.
Okay.
Yeah,
let's talk about what you're celebrating, though. Maybe you can take it. What is it that the Trust Hospital Welfare Association is celebrating?
Yes, the Trust Hospital Welfare Association is celebrating its annual, week, and this is actually the first time that we are celebrating, the welfare week, and in health promotion, we have what we call quality health care, and then we also have the lifestyle, and these two things belong to the curative aspect of health, and then we have the preventive aspect of health. When you are dealing with the health promotion, you have to make sure that you ensure all these aspects of health, so that at the end, the clients, the citizenry, will be able to sustain their health. And the Trust Hospital Welfare sat down, thought about it, and then said that no, this time we have to champion quality healthcare for a healthy lifestyle. And that is the reason why we put up the team and then decided to make a week for it.
Maybe I can come to you, Dr. Osei. What are some of the common cases that people are reporting these days that you think it has directly to do with the fact that they are not taking good care of themselves?
Well, I think the disease patterns have changed of late. We have more of communicable diseases. In fact, if you look at the 10 top conditions that we get at the Trust Hospital, number one is hypertension and its complications. Hypertension and its complications. And then we have diabetes also on the rise. We have complications of diabetes. We have a lot of diseases that previously we're not getting, and I think it has something to do with our lifestyles now. Sedentary, we are getting more of cardiovascular accidents. We are getting deep thromboembolism. I mean, deep vein thrombosis is commonly diagnosed, and it's all due to sedentary life. So, well, you can easily say that now our lifestyle is affecting the disease pattern that we're getting now.
So ideally, how should one be living?
Well, I think life in moderation, exercise, good food, and then enough rest.
How can we begin to change this? I mean, if you have to wake up really early, you have to eat late because you get home late, how do you then begin to change the normal things that you do every day?
Well, as part of what we are doing now, if we continue sensitizing the public, that no matter how busy you are, I think you can still make time, even if it is twice or thrice in a week, for some good exercise. I'm sure when people know the effects of sedentary life, probably people will actively, play some role in improving themselves. Yeah.
Dr. Duntia, you want to add something to that?
Yes. You know, you have to believe in a life that, you know, will be able to sustain you up to a point. And we were talking about lifestyle, and we have to know that every lifestyle has a lifespan. So if you engage in a certain lifestyle that can support you up to, let's say, 50 years, at 50 years, all kinds of disease will start coming up, and then you expire. Up to 60 years, that's it. So you have to be very mindful. And with this, we are talking about good diet, and then good exercise, and then good hygiene, and then good rest. So if you are able to employ these 4 factors, then your life will go on. You were saying that fine with the busy schedule of individuals. Yes, everybody is busy, but you still have to plan your life around your work. It's not work, work, work. You have a life to protect.
I've heard somebody say, and I think that person is a doctor. I've heard somebody say that, doctors give all the good advice, but they are the worst culprit. I mean,
well,
you eat breakfast, lunch, supper in that order.
Our job is to advise anyway, so we'll continue doing that. But don't watch what we do.
Oh, that's it. We shouldn't watch what the doctor does.
We will rather, we want to exhibit leadership by example, though. But I think we will have to go ahead and tell you what is right, and then.
But have you looked at the reasons we're not able to go by what the doctor says?
Well, again, I think it's the lifestyle and behavior and then attitude. So we have to continue to do the promotions we are doing now. And again, I think if we continue sensitizing the public, now you can see that a lot more people are doing exercises than it used to be, which means there's something right going on in terms of communication, you know, of what they need to do. Yeah.
So when you exercise regularly, I mean, is it that you will not get sick ever?
The first thing that you have to ensure is the diet, good food, because that's the starting point. Your food is your first medicine. So if you get the fundamentals wrong, then it means that whatever that you come to add to what you have wouldn't be enough. So the food is bad, and then you start exercising. That one, you will not gain anything. But if the food is good, and then you exercise, then you get the benefit. Then the rest will come in, good hygiene will come in. Right.
Okay. So let's talk about some of the things that you've lined up to do this week.
That's, yes. This week, that's Saturday, we are having a health walk at Elwak. We'll move Elwak then to 37. We'll go through Mopabia, then airport traffic lights, airport roundabout, and back to Elwak. Then at that place, we will also be having blood donations, and then we will do health screening. We will do all kinds of screening.
All for free?
Yes, for free. We will do sugar checks. We will do cholesterol checks. We will also do the hepatitis B and C checks. Yes, for people who will come. And this is open to the public. Then on the 25th, we will also do health screening at the World Trade Center. That one too is for free. And then on the 27th, we will do another health screening with a mini clinic at the Osu Market. Yes, so these are the things that we will do. And then finally, for the staff, we will hold the get-together on the 28th. Yes.
Okay, that's not open for everybody.
That one is for the staff.
You said the staff. Yeah. Okay, so Dr. Idunsia, you know the situation that we find ourselves in today, that's very hard. What can you do as a person? I know that you can't predict what can happen the next minute, but how can we keep safe so that we don't get sick regularly? You may not get the attention that you probably require.
Well, I think the first thing is regular medical checkup. Normally after 40 years, we advise that if you can do 2 medical checkups in a year, We have some programs like for Men and Well Woman, where normally all your vitals are checked, and you can get the benchmark for your condition. And for women, you do the mammogram and then your cervical screening, plus the other vitals. So when everything is fine, there you go. But then if there is a problem, then we can check these things on time, because timeliness is very important in healthcare. You know,
so this you say is twice a year if you can?
If you can afford, if not even once in a year, it's appropriate. And then we encourage that people walk in and then voluntarily, not in some cases people demand that maybe their workplace. But I think for your own good, you can also walk in and then do some medicals every year if you can afford.
You keep adding if you can afford.
Yeah, affordability.
That is expensive, isn't it?
Well, affordability is one of the dimensions of care, and I'm sure that we have certain basics. You are not supposed to do the thorough medical checkups, but there are a lot of other packages, and I think the minimum ones can capture most of the vitals that are required too. Yeah.
Okay. All right. Any more thing you want to add to everything that has been said?
I will take this opportunity to invite the public to the health walk. And they should come. It's starting at 6. And then when you come, you will benefit from all the things that we have just elaborated. And then after that, if we have to still follow up on you, we will do that. Yeah.
Okay. I'm a little curious, just before you go, do people just walk in to the hospital to want to donate blood? Is this something that we do as Ghanaians?
Well, few people do. We have, blood donors who every year voluntarily do that.
Okay.
Apart from that, I don't think it's a habit. And then we are sensitizing the public if we can do that.
Do you get something? I mean, would I get something when I come and donate, or I just come and do it and then you watch me go?
Definitely, you'll be issued with a certificate, and then with that certificate, anytime you have any difficulty or your relation, I'm sure you have the advantage of getting some blood also from other people.
Oh.
Yeah, once you have the certificate as a donor, you have that privilege. Anytime you are in trouble, I'm sure you are recognized as a voluntary donor.
All right. Okay, so I wish you the best in your celebrations, and thank you so much for being here today.
Thank you.
My guest, Dr. Thomas Edunsia, who is Welfare Chairman, the Trust Hospitals Welfare Association. I've also got the General Manager of the hospital, Dr. Darius Kofi Osei, joining me.